Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Part of CPT. So as we get started, just a little notice that I'm striving to be accurate, but it's not intended to be legal or other professional advice because I'm not a lawyer, and AMA owns the copyright to all the CPT and the modifiers, so this is theirs. And just a little disclaimer that if you misunderstand me somewhere along the line and somehow use the material wrong, I take no responsibility, and nor does Audio Educator. And hopefully somebody giggles about that, because usually when I do my presentations live and I talk about this slide, I get a little giggle from everyone. So modifiers are actually all about the money. You know, it's the easy way to remember when you're using it. It helps us determine what is our best selection. When we're trying to decide which modifier do I use, which one do I use first, always think about which one is going to affect my money first and which one is more informational. Always think about the one that's going to affect the money in terms of the one that you're going to use. So, for example, you never use 51 and 59. You're going to use one or the other. So if 59 is an applicable modifier, and we'll talk about later when you use 59 and why to use it, you would want to use 59 because 59 is going to be about the money, not 51. 25 and 57, both of them are about the money, and we'll talk about what the difference is between each of those. So there are two levels of modifiers. There's level 1, which are the ones that you find in your AMA CPT book in Appendix A, which are the modifiers we just talked about, 59, 51, 25, 57. They're all level 1 modifiers. But there's also some letter modifiers that are in there, like RT, LT, and things like that, but not all payers pay for those. So keep that in mind. And then there are level 2 modifiers, which are found in the Federal Register, and they are in your HCPCS book by various publishers. And they are modifiers like Medicare has specialty modifiers like your GA, your GX, your GZ, your ambulance modifiers, and things like that. And so you will find those there. And I'm actually not addressing those. I'm addressing the level 1 modifiers that you find in Appendix A. So what do modifiers do for us? They are changing the core meaning of our they're changing the code description of our CPT code, but they are not changing the core meaning. They're changing the description a little bit. They're saying it's this, but a little bit different, but it's not changing the core definition of our CPT code. They are providing additional information to the payer regarding the service provided. Because remember, most times we don't want to send in operative notes. We want to send in a claim and have it automatically adjudicated. So by having our 5-digit CPT code, sometimes that's not enough information. And so by adding that 2-digit modifier, we're giving that additional information we need to be able to get that claim auto-adjudicated. It's to the benefit of the payer because they don't have to have more people handling that claim. They don't have to have higher-level people in terms of certified coders reading the note and looking at it and spending labor hours to abstract that claim. And it's better for us. We get paid quicker. We don't have to send in the notes. We get an electronic transmission, and we get paid. It's a win-win all around. It's better for the payer, believe it or not, and it's better for us. It tells our story more clearly because sometimes our 5-digit CPT code is just not sufficient. And it's an integral part of CPT and the HCPCS coding system. And the reason I say that is I don't know if there's any payers on the phone, and if there are, I'm sure I'm not talking about your company. But there are payers, and there actually some of them are Medicaid payers who only recognize some modifiers, and they only pay some modifiers, and usually those are the modifiers that reduce payment, and they don't recognize other modifiers, the modifiers that get you paid or increase payment. And that's not correct. because the modifiers are integral to the CPT.
SuperCoder is the fastest-growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.